Hello, welcome to the treatment group video for depressive and bipolar disorders. My name is Dr. Lisette Jimenez, and our client today is Jason Halston, age 37. For our differential diagnosis, we only have one, and it's cyclothymic disorder. The primary diagnostic features, there are two. The first one is cycling between depressive and hypomanic symptoms occur with this disorder, but lack the severity of a major depressive and hypomanic episode. And the second one is must be symptomatic for at least 2 years. So moving on to our client's backstory. As I mentioned, Jason is a 37-year-old man. He's a computer salesman who is seeking psychiatric consultation at the insistence of his wife. She told him that if he didn't figure out what was going on with him or what was wrong, she was going to file for a divorce. Jason states that the only reason he went for a psychiatric evaluation was because he loved her so much and didn't want to lose her, but he doesn't believe that there's anything wrong with him and it's just a waste of time. He admits that he has good and bad days, but dismisses this because it's true for everybody else. When asked to describe about his good and bad days, he describes the bad days as sleeping 12 to 16 hours a day, lacking energy, confidence, and motivation. He states that he feels like a zombie on those days, and he usually has to drag himself out of bed, but it usually results in him sitting on the recliner watching TV all day. When asked how long he's been having these bad days, he indicates that he's been having them for as long as he can remember. He explains that these periods don't really last all that long, varying from 3 to 5 days, and then the good days return. According to Jason, the typical good days, he feels confident and very sociable. He indicates that he's thinking sharply and just has fantastic thoughts come to him. When asked what his wife takes with the issue, he explains that when he's having these good days, sometimes he may drink a little too much or use marijuana, and she's caught him cheating a few times. He admits that he actively sought to keep his promiscuity from her, but rationalized his secretiveness by stating that women just can't keep their hands off him because he's irresistible. He thinks of himself as a powerhouse of a man, and it's his duty to share himself with as many women who desire him. He complains that his wife doesn't understand this obvious fact, and he admits that he uses the alcohol and marijuana to help him sleep when he's in his good days period. The good days last from anywhere from a week to a month, but usually would end abruptly when he would awaken one day and suddenly it's a bad day. In school, his grades were spotty. When his mood was up, he would do well, grade-wise, but when he was down, he would do poorly. This inconsistent level of achievement led to his teachers and parents to believe that Jason was a bright kid who just lacked the motivation to apply himself. This pattern is also seen in his job. As I stated before, he's a computer salesperson. When he's in his bad days, it's not unusual for him to call in sick, or when he does go to work, his performance is lackluster, to say the least. When he's in his good day cycles, his confidence and charm seem to lead to stellar sales levels. Although considering that he is in many social circles, he alienates friends when he is hostile and irritable. He typically accumulates social obligations during bad days and then takes care of them once the first day of a good period begins. So that is it on the backstory on our client. Moving on to the multi-axial diagnosis. So axis 1, we have cyclothymic disorder. Axis 2, we have none. Axis 3 is none. Axis 4 is marital relationship in jeopardy and work difficulties. And axis 5, his GAF is 60. And as for the theoretical perspective, there's only one. It's biological perspective. The client's symptoms may be due to genetic predisposition. There may be a deficit of serotonin or norepinephrine that can cause depressive symptoms. Likewise, the client may have an excess of norepinephrine that can lead to hypomanic-like symptoms. And that is it. Thank you.